I get it. If you walk and you're walking like this every time, there's something wrong. Except you are just dancing. Are you getting me? And having fun, That's what everybody is counting that. When you are going to your room and you walk more than 1 second to do 1 meter. You're not doing 1 meter in 2 seconds. That's a problem. So you just look at how many times you cover and divide it by the time you use. So you can do it at home. You can wake up in the morning in the house without anybody doing assignment. Forget about whether you can do it or not. Just wake up and just say, Father, we thank you for today. Just begin to exercise yourself as fast as you can. And with time, if everyone in the house, I'm not saying you should go to the streets every day. You can, if you can do that, it's very difficult for you to fall. It's very difficult for you to fall. Because with time, your muscles are strong. 2, if you're sitting down and you can't stand up, suddenly. We're going to do that now. I want to see how many people can sit down. Cross your 2 hands on their chest like this. Yes. And then say, when I say stand up, you stand up. When I say sit down, you sit down. In fact, when I say stand up, you stand up, upright, and sit down. Stand up, upright, and sit down. If you can do 5 of those within 12 seconds, it means you have the capacity also, you are healthy. Start. Up. Sit down. Up. Put your hand across your chest like this. Sit down. Up. A little bit faster. Sit down. Up. Sit down. Up. Sit down. If I just stand here, I don't sit down. Yeah, it's okay. I don't want to be. No. If you are breathless, there's a problem. Are you getting there? You did it because you are competing. It means that if you are, and I'll go back to my health. After my surgery, I found out that I couldn't stand up easily. I didn't. The surgery wasn't on my legs or my hands. So I found out that if I sat down like this, and I want to stand up, you see, nobody told me that that's not the normal way to stand up. Are you getting it? I was coming back from somewhere. I took an Uber. I came down from the car of the Uber. I sat at the back. I fell down. That was what shocked me. I was ready to fall down. Am I an old man now? But I cannot stand up from the car, coming out of the car. That was a problem. I had to go back to the physiotherapy, cardiac rehab. I get me, and fingers a problem. And it's not just getting up and standing up, that sitting and standing up. It's not just about glucose measurement. It's also about balance. Your balance is controlled in your ear. Ear is not just for hearing alone. It's for balance. That's why adults sleep, S-L-I-P, in the bathroom. One of the biggest challenges for women is lower estrogen after menopause, and this affects their bone strength. If you fracture your bone after the age of 60, few people will give you chances of making it. My mother died at 72. Why? She had a fall in the bathroom during what we call the bomb blast in Lagos in January of 2001 or so. There was a bomb blast incident where people were running in Lagos around the Chico. People were just running. You know where Adikaya can see? People were running. But she was in the house. She fell in the bathroom and broke her hip. She had the surgery, hip replacement, but after the surgery, she couldn't get out of the wheelchair. She couldn't stand on her own. It took a long time. And not using a wheelchair alone made her to be crying because she was a very, very agile person. So they were saying, this one, when they said she would use the wheelchair to go and use the wheelchair to go to the bathroom, but she was telling herself, when will I get up from this wheelchair? She lost the will to live. because she said she can't be living on this wheelchair. She couldn't go to church because our family house was upstairs. I will never live upstairs when I'm older than this. I've tried to live in the bungalow. Not because of any other thing. You have to begin to prepare on how you can live longer. You can't be living on 4-story building, 4th floor without the lifts. So to carry her down to go to the hospital, we have to carry her physically, fold the wheelchair, take the wheelchair downstairs. And in most of those staircases, they bend like 2 times. Come like this. They bend like this. Come like this. They bend like this before you get down. And after getting down, push her in the car. When they put the wheelchair in the boot, when she gets to the hospital, you have to bring out the wheelchair, and you have to. And most hospitals are not even built for wheelchair. Yeah. You're about to enter the OPD, they carry her again. So what is all this? What is all this? So we have talked about walking, trying to walk, trying to get off of the chair, and those things are very, very important. When you wake up by yourself in the morning, don't hold anything. Sit first. If you're afraid you will fall, sit first. Take your time. Get up suddenly. Sit down again. We used to do this in primary school. We didn't know it had any meaning. They say, right, sit, right. What was that song about fishermen? I'll make you fisher out of men. They say F, women should get up. Yeah. They say M, men should get up. Fisher out of men. We didn't know that they are preparing us for old age. Being able to stand. I give you an example of some things. When I want to sing in school, they say, breathe in. Oh. Breathe in, we'll be laughing. We didn't know that those things were really exercises as well.
Yeah.
But then, here we are today. So walking speed. If you can do up to 1 meter per second, you are good. 1.2, very good. Then grip, one leg balance, you have done that. Then grip strength, being able to hold something tightly. The test for that is the dynamometer. So you can use the bathroom scale. If you have a bathroom scale, you push it on the wall. You put your 2 hands on the bathroom scale. As you are pushing the bathroom scale, it is reaching. You can get 25 kilograms. And your grip strength or your ability to hold or push something is very, very important. If you cannot push something for a long time or hold something tight, you can start trying it with balls. Hold the ball, release it, hold the ball. I've got a physiotherapist in the house to take my mother through, and we got a lawn tennis ball. The first thing physiotherapist did was to tell my mother to hold ball and leave it. After that, we paid it. My mother called us, what did we pay him for? I said, you paid physiotherapy. He said, what did he do? Is it this ball I'm holding? I can do on my own. Like I want to play for. He shouldn't come back here. The man didn't come back here. Because my mother wanted, like Naaman said that, I can't just go and bath and be okay. My mother said, holding ball and releasing. They paid the man 7,500 naira. I said, you shouldn't bring it for us. Victor. Yes, it was Victor. And so with these things we have talked about, basically being able to stand on one leg, being able to get up and sit down quickly, get up and sit down. You can try it at home. When you are sick, don't try it because you can't do it. And you should be able to get up and sit down like that for like 12 times. In 1 minute. Get up, sit down, get up, sit down. Then go to 30 seconds. Get up, do 5. Get up, sit down, get up, sit down. If your eyes are turning, you stop. You know, so it means there's something wrong. Are you getting me? So we're back to that. So when we talk of cardiovascular health, it's also very important. You should know your blood pressure, your resting heart rate when you wake up in the morning. I'm sure all of us know how to count our pulses. Just take your left hand with your right hand and put between your thumb there and this first finger here. There's an artery there called the radial artery. If you put your thank you, that's it. If you put, and you put to use like 2 grams of water, you will feel it. You don't need to go to your school to do it. You can do it at home. It's called a resting pulse. If your resting pulse is more than 60, without subjecting yourself to strenuous things like running or something, that's why it's called resting pulse. So if you look at 150 to 70, if it's resting. Sometimes if you are typically 60 to 100 without any problem in your life, you can go there. But then that's not as problematic as having 120 at resting. Same thing with blood pressure. You get that blood pressure is 120/80. That's not exactly true. Your blood pressure is your blood pressure as you began to grow. For black women, their normal blood pressure is like 100/60. And blood pressure treatment is the most difficult treatment in the world today because it's now a black man's disease. Anything that just centers on black people, nobody will be able to do research on it because we don't have money for research. We follow what the white man has already researched. So most of the drugs that pull down blood pressure among whites cannot pull down blood pressure among blacks. So most of the cardiologists do that. Have you taken a BP? You're taking 10 milligrams. This is it. This BP. If they give it what they give to a black man to a white man, they die. So when a black man will take these drugs and they don't get that. And so your blood pressure is what your resting blood pressure has been when you were in your 30s. If your blood pressure is 140/30, 124/90, you'll be taking your blood pressure and you should be able to know what you can call your normal blood pressure. It's not when you have developed hypertension and you need drugs to bring down the blood pressure. That blood pressure you bring down with drugs is called drug-aided blood pressure. But your blood pressure was resolved with drugs. I don't know whether I'm getting my point. They don't use drugs here because they take drugs as recreation. So use medication. All right. Or you say, I'm on drugs. You don't carry it. So the cholesterol, we have the low density LDL, and HDL is a good one. Just think of high being good. High density cholesterol, high density lipoprotein. Those are good things. Then triglycerides. Additional assessment you need at this age is coronary artery calcium score. That's to determine whether your heart vessels are blocked, atherosclerosis. It's called a CAC. Just think of CAC as a church and ask your pathologist, I want to check your coronary artery calcium. It will, every 5 to 10 years, it's good for you to check that one out. Electrocardiogram. Once when you go for your annual check, you can do it. If you have heart issues, you want to do an echo. Then hemoglobin H1C or hemoglobin A1C, sorry. That is the gold standard for monitoring diabetes. Your blood sugar is not predictable because some people can even starve themselves before coming to the hospital. When you take their blood sugar, it will show a normal blood sugar. So you have to now have what you call HbA1c. The shortened form is called A1c, or medical personnel. The A1c should always be less than 5.7, or I can say anything less than 6 is good. 5.7 and below is the gold standard. Now, what does A1c measure? A1c measures the aggregate of your blood sugar for the last 3 months, 90 days. It takes, your blood cells last only 120 days. After your blood cells have reached 120 days, the screen removes them from circulation and say you're too old to go back. You take them out. So when they look at all the blood cells, they look at the blood cells that have sugar around it. They pick them up, and that's what will form the A1C. So if your A1C is above 6, you are said to be having what you can call, you have no symptoms. Are you getting it? when you be told that you're pre-diabetic, that means you should watch it. Borderline. Take care of yourself. Blah, 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 blah. So that is it. I can see some people who are already, they look as if they are praying, but they will be sleeping. But I want to assume that they are praying for all of us here, that God will keep us. Then your waist, the size of your waist. I didn't come in the morning session because I fall asleep between 9 and 10. I don't want to deceive myself. So I just stayed in my room. I said, if I get here between 9 and 10, that my wife has complained about the sleep. Anytime I enter a car from 9 to 10, I just want to say, before I enter the car, I'm very strong. Once even in university, once that 9 to 10 lecture was an attack from here. I'll just be writing C. So I just respected myself, you know. And so people fall asleep in the morning because most times our sleep at night is not deep enough. And we're trying to compensate for the night sleep. And again, if you're on sedative, diazepam, Lexotan, you find out that you never have enough sleep in the night. In the morning, you start having a call back to sleep. So we have the waist circumference. Waist circumference. There's a waist circumference that is recommended for your waist. You can ask your doctor to check it for you. You have the body mass index, BMI, which is the correlation between your height and your body weight. Then you have body fat percent. All these things are things you can check. Every year you should do your kidney and liver function. Kidney function and liver function, they have what they call the creatinine. If your creatinine is more than 1.2 milligram per deciliter, it's a source of concern. Then, so that's the creatinine. You also do your EGFR, estimated glomerular filtration rate, checking on the efficiency of your kidney. If your kidney is not able to excrete well, you will know. The same thing with urine albumin. Check your urine for albumin. All these things are pre-kidney collapse. So you should do this like once a year. Just tell them to check your EGFR. You know, small letter EGFR. Your liver enzymes and bilirubin will tell you about the liver. You know. Then periodically too, you check your high sensitivity C-reactive protein. If you have been having a lot of internal inflammation, it will be high. You don't need to be sick. When they do your ESR or SHS C, high sensitivity C-reactive protein. The C there is C-reactive protein. When you check it and it's high, just think of CRP, C-reactive protein. If it's high, there's a lot of damages going on at micro level inside. And the doctor will insist on complete blood count. The important things about your nutrition is vitamin D. Very, very important. Vitamin B12, iron storage, very for women, and albumin. Then I will want to round up with brain health. Now, apart from the standing up on one leg, sitting and standing, you can also test brain health. Brain health is not just memory. Brain health is also ability to think. If 3 people are talking at the same time, can you pick all the 3? These are the things. It's not that you are dull of hearing, you have hearing problem, you're hearing well, but you can't think fast. You can test that by crossword puzzle, by playing Scrabble with your partner, by counting backwards. If you tell you to count backwards from 50, you find it difficult. So it looks easy. Who wants to try? I call on people that are praying like Philip or somebody else. Oh yeah, they are praying for us. Can you count 50 backwards? You can sit down. Count 50 backwards. Go speak it out loud, let us hear it. Backwards. Count it out.
50, 49, 49, 50,
49,
48, 47, 46, 41, 45, 44, 43, 42, 41, 40, 39, 38, 37, 36, 35, 34, 33, 32, 31, 30, 29, 28, 27, 26, 25, 24, 23, 22, 21, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4,
You see, age has a problem with us. As you are aging, you're always suspicious. Making a mistake. Nobody here can pass jam. Nobody here can pass. It's not because you don't know what to write. It's that you look at question 1 10 times. Among these 4, which is bigger? It's B. You'll be here. The children don't look at all those things. See, number 2, 7 times 7, the B, they just know. You, even if you get it, you don't give your paper. You'll be looking at it, I don't want to miss anything. No? I'm old enough to know this thing. No? So that fear of making mistake made him to wait sometimes. If you tell your child, you don't know, when I miss it or not, he will finish it. But it's not that he doesn't know it. Is that he's afraid of missing something because he knows we're all looking at him. So he said 47, 46, 45, 44, 43. Go to that, like this will laugh at 40, 39, 40. But as simple as it is, he couldn't get people, he couldn't be fast because he was being careful. In same manner too, the ability to know what to do at red lights. If you were driving and suddenly you see the amber, you don't want to slow down. You find out that you still passed it. Your wife begins to tell you, cross the red light. Forget. The point is that the ability to react in very short time makes a lot of difference. You want to put your key at your door. This is the door you'll be opening for the last 10 years of your life. Are you getting? You get to the door with your key, you start looking at which one am I going to use now. You bring out the key. You cannot put in the right key after many years. Are you getting me? It's not because you are mentally sick. It's age too. So all those stupid things that we do. I remember once I was looking for my glasses. And I looked everywhere, I didn't find my glasses. After giving up, I went to pick my spare, only to find out my glasses were mine. How do you explain that? How do you explain that? So when I wanted to put the second one, there was no space. I was still bold, trying to still put it in. And I had to tell myself that there's something there already. You know, the same thing too with wristwatch. I looked for wristwatch until I went to pick another one. When I entered the car, I found I was buying 2 wristwatches. But when I was looking for that one, did I have this one? What made me to now boldly? And that everybody that sees you know it's not the fashion. You know there are some things you can't explain away. That's so God like him. You know, you are wearing 2 wristwatches on one hand. That's so God like him. They know something is wrong with you already. 2 wristwatches on. Who will you explain that to? Say it's a latest design in town. Something is wrong. Something is wrong. So there are things that have affected us with, and we have to begin to check. Don't laugh at it. It's a sign of aging. And the simple truth that if you can pick it up, criticize yourself early. The Bible says, if you judge yourself, no one will judge you. But criticize yourself early. Arrange your wristwatches where you can pick them. And your eyeglasses where you want to keep them. So when you wake up in the morning, just go there straight. There's no point. Every time you are looking for your socks, every time you are looking for your wristwatch, you keep the whole house on a standstill. My father will tell us to look for his phone. We say we don't rest. Everybody should. If you are sleeping, they'll wake you up. That is looking for his phone. And I tell you, I don't use his phone. You'll be looking everywhere for his phone. Every day, you know. You must find this comb for me, you stupid children. You have taken my comb, And at the start I said, why is he asking us to go first? Because in our generation, that is your father's couple. It's nowadays, I just see my son wearing my shirt. And I said, this is my shirt. He said, oh yeah, what are dads for? In our days, it's like you can't even try. Don't call to you to what you even try to wear your father's shirt. So what are dads for? So we have to keep our clothes in the right places so we don't become a burden in the house. Tell everybody to wake up because you can't hear, you can't think very well. You know? Sleep. Sleep is a very important thing as you grow older because you likely have sleep difficulties. For women, it's more challenging after they enter menopause. Sleeping becomes a big challenge, and memory loss for women. Women tend to misplace their things after the age of 45, 50. Simple things like that, they begin to, because it comes with hormonal issues too. They sweat a lot, even under air conditioner. They will tell that this room is very hot. This room is very hot. You say, this room is cold. You said, well, it is hot. And I'm the one feeling it. I'm the owner of this body. I can't take it anymore. Put on the AC. He said, this is, after I went, he said, it's very cold. It's very cold. Put on the AC. He said, which one? They're in charge of the thermostat. They're in charge of the AC because there's a hormonal challenge inside your body. And this hormonal challenge comes again with the fact that age, when women are beginning to move from active menstrual cycle to pre-menopausal to menopausal and post-menopausal, it's also the time when the last child leaves home. You know? So they begin to put all the burden on their husband. Of course, you are the one that didn't find my restaurant. I don't even know why you're in this house. You are more used to me in this house. You know, my children are even more useful than you. You know, that is the age of the empty nest. You now begin to blame yourself, even for your headache. Are you getting me? I told you I have a headache. You didn't even place your hand. You're a man of God. You didn't place your hand on your head. When you place your hand on your head, the only way you can be satisfied is for your hand to remain there until the headache goes. When you feel you say you are healed in Jesus' name, you have to continue to put your hand on your head like that. Are you okay now? It's going down. Father, we thank you. There's no more faith in this one. You have to continue. All this slight headache, slight feeling uncomfortable is hormonal storm. And those years of hormonal storm, I know in Africa and most developing countries, hormonal replacement therapy, people don't even go for it because at the end of the day, the common disease is typhoid and malaria. Everybody is typhoid and malaria. So we don't diagnose the fact that people that are that age, and because the last child is leaving home too, as I said, the husband carries the brunt. Other things that come with this is that as the woman is getting older, female hormones drop, masculine hormones begin to rise. That's when women contest for supremacy in the house. I get me? And submission is different. You must love me before I submit to you. The Bible says, men, love your wives. After that, there's a full stop there. Then it says, submit to your husband and submit one to another. As fitting in the Lord. In the Lord, in the Lord, in the Lord. And so I cannot, woman's eyes are eating the fruit, and eyes are opened. Who told you you are naked? Have you eaten of the fruit whereof I told you? Because they are past the age. So that's why divorces are common at that stage in life. Women begin to want to go and read esoteric courses. A woman is okay, when you came to this country, if I'm not on my PhD, I won't sleep. That PhD, I must get it. But your husband is okay with masters. Are you getting me? He's working. So now you are the one that is okay with masters now. I must be called a doctor. I must have a PhD. With due respect to our sisters who have got a PhD, I'm not laughing at them. I'm saying, there are times that demonic drive for the PhD is not of God. Are you understanding? It's a result of hormonal challenges. When you can't sleep at night, would you like to read? When you can't sleep at night, what will you be doing? So read now. After getting master, say that's not enough. Something is telling you that there's still more land to conquer. Are you getting me? Don't rest. You continue to do until until you have scattered the marriage. Then you now say, oh my God, I have a PhD without a husband now. You understand me? So it's going to do a PhD, but at that age of 50, most people go into menopause. Just look at it. Menopause is the age you started seeing your period, and you add 35 years to it. 35 plus 18, you get 35, that's like 53. Am I right? It's about the menopause like that. But our children now seeing their period at 11. So they're going to stop seeing their period at 46, 48, and some of them will start seeing their period at 40. I have patients that come to my clinic and start seeing their period at 10. At 10. Have you heard of that before?
Yes.
At 10. So in as much as it is something we say, oh, my child is getting to puberty, we should also know that the age of not seeing the period is also coming up. So the empty nest, when the children are not around again, at the age of post-menopause, women also lose interest in sex. So they have what they call female SAD, female SAD, female sexual arousal decrease. You know? So they begin to have a decrease in sexual arousal. Now, at that age, you see so many things come together that it's difficult to pin it on just post-menopause. Because that's the stage that the children have left to. That's the stage that she's interested in going to do accounting. After doing education biology, she wants to go to accounting. Or after doing Yoruba BA, she wants to learn nursing. So, at that stage too now, the pressure to succeed, she wants to do international trading. I'm going to Dubai, I bring things, when she was 20, she didn't do it. When she was 25, she didn't do it. When she was 30, she didn't do it. Now she's 52. I have to go into Dubai to bring things. Those ambitions that appear to be highly irrational in the eye of the man is coming also because she can't control herself. She has changed from being the woman to being the man too. More vocal. She'll tell what Donald Trump said. That's not Donald Trump said it. He said it this way. In fact, the FBI director is no longer this. You are missing it. You think it's coming. It's no longer that. It's no longer everything. I know. You begin to wonder that, am I safe? So these are the things. So sexual arousal syndrome also comes in, the death of sexual arousal, because at that stage also, the children have left the house. She's now just take it from me. Any woman that the last child, last children in Nigeria go to boarding house. Here, people don't go to boarding house. Most cases you do J school. So you say your last child entering secondary school. I thought it's boarding house, secondary school, yes. When your last child enters secondary school, the house becomes empty. Who do you want to shout on now? When the house is empty. This is not your husband you shout on. It's your husband you shout on.
Your house help.
You don't have many people have house help. Your husband you shout on. And then you shout on your house help plus your husband at the same time. You know, things have changed. So sexual arousal disorder, FSAD, female sexual arousal disorder, also comes up because over the years, in menopause, recent memory is a problem. Remembering where you get your keys, remembering something recent is a problem. But guess what? Old memories begin to come back. That's when you remember that your husband, before you married you, was in love with one girl, and that girl is in this town. I'm suspecting them. Old things. Are you getting me? When I married you, I remember when my mother-in-law used to shout, "It's now." We're getting the things out there. It's now you want to remember that your mother-in-law is a witch. When you were in your 20s, you disregarded all those things. Your 30s, you disregarded all those things. Now she comes in, you want to hide everything. These are the things that are coming with menopause too. Menopause comes with slight headache, comes with sweating of the palms, comes with unusual energy, because you are becoming a man in a way too. So there are two men, two captains in the same boat. So we now look at that. So when is sexual arousal done? Is sexual arousal disorder? Is because at this stage also the lubrication in the female genital tract decreases, so she feels pain with sexual intercourse. So she doesn't want to do it, she's afraid. Especially if post-marriage, the hymen that shows the virginity was not properly broken, there's always pain. Now, with the decrease in lubrication, the woman begins to feel pain. And that's why the proverb, now food. When you say, I want to say, now food, you want to kill me, now food. It has come up now because, not because of the age per se, because of the hormonal challenges and the degree. And then it takes you a long time to set her up. You have to try to say foreplay. You do foreplay till it becomes 8 play. Because it's not easy again. It's not easy again. You will do foreplay 4 hours. Say, continue to rub my and the man will sleep. Say, I'm very lazy man. You know, the decrease in secretions is very beautiful. Then, after that, you know, one other thing that makes sex very difficult is if old events begin to come to your heart. My husband was so faithful to me when we were in Makoti. I can't forget that. Now that was 30, when he was 27. Are you getting me? It's at 54. You might remember my husband was so faithful to me. I will show you. I will show you. The revenge is because you don't want to do. You are now going to pick. You don't, I'm going to pick things that have passed the statute of limitation. Are you getting me? But you have brought it up now. Are you getting? Hey, what are you? What are you doing with that girl? So we get. When we were Makodi, let us. That girl you were moving. Some things have passed away. We are serving the God of the church. I'm not the God of the second chance. I get it. I'm a woman. I can't take it from you. You know, but what did you do throughout your 30s? You tolerated it. Throughout your 40s, you had children to take care of. And then you wanted to make sure that your home is enough. Now, you are ready to leave this house. If he says, go, I have PhD, I have skills, I will get a job. In fact, how much you bring into this house? Right? That's the age of also finding out how much you bring into this house. So men have worked in their 20s, they have worked in their 30s, and men burn out in their 50s. Because most men cannot do hard things after 60. You really see men going to take a new program at 60. See, I want to now send our brother here to go and study Spanish. You are praying for his death. You are praying for his death. A nutritionist, then go and study Spanish. Don't kill him. You should not tell him go and die. But if you go and meet Sister Ngozi here, and say go and study Spanish, power still there. So you face it.
Study Spanish.
Power still there. It's not that our brother here cannot do it. He has too many important things to be thinking about. He has not finished his mortgage and he's struggling to pay. He has other things to do. Okay, what do I want to do with Spanish? This is English stuff. I'm not finished. I'm not studying it. You say, go and study medicine. At this age, I want to do 4 years. Sir.
I just wanted to inform you that I've just registered for drug and alcohol counseling at Montclair University. So, while my wife is studying Spanish, I'm studying.
And now you can do that because the house is empty too. The house is empty. But let's interrogate that thing. It is good to go and study counseling because it's pastor.
Yeah.
But I want you to go and enter School of Nursing. September.
What am I doing?
That's the point. What am I going to do there? What am I going to do in School of Nursing? I said, I want to go and do nursing. So let me do drug, alcohol, counseling, Of course, as a pastor, it will enhance his profession. And there are many things they've not even reached the psychology of counseling. Counseling is already a counselor. When they are teaching him, he's even teaching the teacher. Are you understand? So he's going to
get the certificates.
yeah, it's not get certificate. But I said you go and do nursing now. He said, what is he going to use it for? Brother, nurses are any more than pastors. No, I'm not taking more. Nurses are any more than pastors.
Not all pastors.
Okay? By the time you go and do nursing, and then you pastor on Sunday, you add that one to it. During the week you are free. You go to New York University, NYU, teaching
Some pastors are flying private jets.
but that's their personal jet. They're not the pilots. To fly your personal jet is not the problem. But mostly by the time you have money to buy a private jet, you have money for a pilot.
Yes.
You say, I'm not flying myself. This is not a car. Thank you. You can't fly. You can't. Your license for piloting expires at the age of 60. You can't fly commercial jets after 60. Yeah?
Of course, they will retire you.
Except you are doing it for somebody, maybe a private jet.
Yeah.
For United to pick you up at 60, your level of reaction to events is not as fast. When we are counting 50 to 0, you are reacting 49, 58, 47, 40, 46, 45. You can't be a pilot. You're already there. So what I'm driving at, we'll finish my fourth lecture. What I'm driving at is that I want to just say this sexual arousal disorder. Every woman postmenopausally does not have the same sexual drive as before. And they make sex very difficult for the man because it takes them a longer time to get aroused. And they tell the man, you are lazy. If we have to read Psalm 119 before you get aroused, you know Psalm 119. What is Psalm 119? It's the longest. If I have to read you know Psalm 119, just waiting for you to arouse. I better sleep. When you are ready, you let me know. Are you getting me? Because at that stage too, the man has many issues. Sex is not something that we die for. If you are not ready, bye-bye to young man, bye-bye to reggae, you will just sleep. So if you want to use sex to punish your husband at that age, he will just go and start reading and go to 3 days dry fast to pray for the war in Iran. So you just wonder why you just instead of suffering, begging you everything, you say, right, you can keep your money, and if you're not careful, somebody else will give to him what you're making very difficult for him to get. So at the end of the day, therefore, we have all these things. So how do we sort out female sexual arousal disorder? It's for the woman to envisage it. I know in advance that from the age of 45, 48, 49, menopause has started coming. And most of our children will see their menopause at 40, 38. So if you have a daughter as a child and is not yet married by 30, 32, 34, thank God for IVF, you can begin to save the egg or something. But it's not a curse. The earlier you see your period, the faster your menopause comes. How many people have seen women that have seen their period very early that you will be surprised? How many have seen women seeing their period at 10, 11, 12? You, huh? You? How? You have seen 9. In your generation, who saw your period at 18? 16? But now 9. Now 9. Add 35 to 9, 44. You know? So by the time she's 42, 47, the period is going. So those girls have a long way to go. They should get married on time. So I want to take questions at this point because as you have seen, I wasn't talking about diabetes, hypertension, and those things. I've spent more time talking about aging rather than disease conditions because those things, when I came yesterday, I sized the age of the people here, and I know that we are mainly more at middle age and older persons. So that's why I moved to talking about aging. Any questions? So then if you have questions, put up your hands. I can count you. 1, 2, 3, 4. Okay. Number 1.
So my question would have been, how do you manage all those chaos you described now? Because because of hormonal, imbalance, a woman is having this kind of crisis situation, and the burden is upon the man. How do you manage it?
Yeah, the first thing is to identify that these things are true, they happen. And look at most churches where women are allowed to be pastors. It's women that control the churches now, they control women's union, control women's fellowship, and they are competing with the pastor for the pulpit. So the male pastors are challenged. The women are the ones that organize programs. They're the ones you see at Night Beach. They feel in Night Beach, they come for choir practice. They think choir practice is wait behind for Sunday school preparatory class. Are you getting it? They have energy for all those things because they are getting stronger as they are getting older. We must know that we are getting weaker. So we have to improve. Are you getting our exercises? Think youth, cut down on sugar, cut down on weight. Are you getting me? Because the things that pull us down is nutrition and also weight. There's no point. You cannot be overweight and expect to live long. In fact, there's no picture of Moses as a fat man. No picture of Jesus as a fat man. I've not seen Jesus, but if you see a picture of Jesus that has a big tummy, you say, this is not my Jesus. This is not my Jesus. All right, Number two. So you like to say it for your wife. Are you getting it? And the Bible says, love does not keep record of wrongs. Are you getting it? In first place, part of it. You understand? You can know that your wife is getting kulu small. Are you understand? And you don't have to come to terms. See, there are some things that are negative. There are some things that are. How do you explain somebody that never shouts on you, begins to shout on you, and tell you that, am I not doing how to want this morning, Lisa? Because you are retired, and you can get a job as a nurse at 58, you can walk into the 60s as a nurse. But there are some professions, once you are even if you allow you to work, you will find out that you cannot cook anymore. So women can walk through, as I said about Japan. Japanese live 3 full lives. When they are below 30, they have some jobs. When they are in their 40, 50, they get another job. A Japanese can retire at 50 and go to another job in the 60s, and go to another job in the 70s, and go to another job. Japanese walk through all their lives until they die. We black people get to, are you still working? You are still working? Don't give room for the devil. Don't come and down my neck. Stop working. Because our life expectancy is short. So our parents did not live long. So when we are living long, we begin to wonder whether we're okay. In Japan, the average child in primary school has 4 grandparents alive. 4 grandparents alive. The average child in secondary school in Japan has 4 grandparents alive. So he's 15. He sees grandpa on mother's side, grandpa on father's side, grandma on mother's side, grandma on father. In our culture, once you are 40, your grandparents are dead. You kill them. Your grandparents are dead. In fact, most of us, our grandparents were not alive when we were in our 30s. That's to show you the low level of life expectancy. But we have to live for our children too, not for ourselves. And that means you must be ready to change jobs, think of something to do that is relevant from home. Always keep on working. People that walk through old age live longer. My father retired at 60, and I was just at home. I was sitting near the window, I was looking at cars passing every day. I was looking at, one day he called me. He said, is this guy going to live till he dies? I said, well, I don't go anywhere. I don't have any salary. I just sit at home. I said, but you can walk now. It's Lagos, I'll start going to walk. So I told my father to start doing trekking, walking 30 minutes, lifestyle, walking 30 minutes. If you walk 30 minutes every day, 5 days a week, your blood pressure will likely come down. There are many lifestyle things I didn't have time to go into now. So I took my dad to walk. The first time he walked, he came back successful. Second time he walked, he came back. I said, he's not going again. I said, what happened? He said, all the Okada riders, Papa, go home. You want to die? Go home. You know, there are no walkways in Nigeria. He said, go home. Go. You want to die? I won't be the one that killed you, go home. He said he's not going again. And they were shouting on him, Papa, go home, Papa, go. He stopped going out. Just sat down there. So being active through old age, being physically active, being sexually active, being emotionally active, connecting with your mates, laughing a lot, can make somebody live longer. You know? But if you look at it, most times in societies like this, you have no time to connect. All right, number 2. Let me just take the 4 questions. Now, question number 2. Who put up his hand?
3, I think it's 3.
All right.
4. Oh, is it 4
All right.
already?
All right, sir, yourself.
Oh, it's 3.
There were 2 areas also I think is, that comes with age.
Yes.
One is becoming hard at hearing.
Yes.
I had a parishioner, white people, who the woman always complained. The guy had hearing 18, and the woman talked a lot.
Yes.
And the woman was complaining to me that the husband always does this, does that, and doesn't listen to her. And the man complains that he normally these days turn off
And even all of us, but you can't only do listen and listen and listen.
Yeah, my mother.
In fact, sometimes to make you sing, you can't listen to everything your wife is saying. You go mad. Sometimes you have to just say sorry. Even whether your head is or not, because you couldn't listen. You didn't hear me. If you listen to everything, you don't die before you. After
The other one is to do with Alzheimer's and dementia. I was at a Bill Graham Center in South Carolina for a 5-day retreat. One of the retreatants told us his wife has dementia and Alzheimer's. So he was invited to a particular church to speak. And they prepared the guest room for him and all that. And just before they should go to bed, the wife reminded him that they are not married and they cannot sleep together. So the man said, we've been married for years. Mentioned the names of their children and grandchildren, and the woman said, no, we're just dating, we're not married yet. So all she remembers was pre-marriage. And then the man couldn't win. They had to provide him a second room. The woman slept alone, the man slept alone. So some of these things can come up with age.
Yes, yes. In fact, the BBC documentary shows the woman woke up the next day and told the man is to go and visit her in the residence. So he told the man that she's not married. One of the members of the house there, they had to do a wedding for them. And they married that man. And the husband came and now had to stand as a best man. You know, he was crying, but the wife said, I'm happy. You have done this for me. Oh, I'm so happy that you released me. I said, now let me start with the ear. Most times as you get older, it's not that we don't hear well. It's that words queue up outside our ears. We can't assimilate things. If you notice, children talk very fast. That's why I say slow down. That's how they normally talk. You find that as you grow older, music is so fast for your hearing. If you listen to your children's music, give it, hey, we will get you, hey, you start what they say, and you understand what they're saying. And you don't want to, hey, and you're telling yourself, is this a song? Why aren't you enjoying it? The words are too fast. The words are too fast. So, words pure. And you now find yourself. If you hear well, then you can't differentiate those things if you've got a pure. So some people don't hear well because they're constantly there, and those aids will work for them. Now, even with the aids now, if you don't talk gently to your grandfather and something, they won't pick it up. Not because it's deaf, the speed is too fast. That's why we are teaching in pedagogy. If you are teaching adult class, you can't teach the same way you teach children. You have to repeat yourself, you have to write as you talk. In fact, slowly, when we're in university, people are in class, because there's a coma. they have done St. Andrews College, you know, they have done Sandwich, they have done NCE, then they did BS, then they came to 100 level medicine. When you are teaching in class, and they always sit in front. From reading their notes, everything teachers say they are writing them. We as teenagers don't write everything, we don't write ideas. Are you getting me? You know, just you know, jokes that the teachers are not relevant to the topic. They will put the jokes there because they are conscious, they don't want to fail this course. So, this man is very tough. So they copy everything the man is saying from the jokes, and then it's still. So there are some courses you can do when you're in your teenage years. Yeah. There are some courses you cannot do easily.
Yeah,
So this thing, if you can't hear well, get a hearing aid. Back in our homes, in our country, the father will not actually use it. If you don't get it for him, he said, put it as I can hear well. I can hear well. But here, they listen to what the doctor is saying, and they get the hearing aid. But this thing of Alzheimer is a very serious thing. It's now traced to blood hypertension taking place in small bits over a long time, so that some of the parts of the brain are affected, especially memory. My friend's mother was teaching English in the university. Suddenly she didn't understand English anymore. She could only understand native Ishan language. So they had to stop her from teaching at University of Lagos. So all she hears is yes or no. These vessels in the brain have been accidented around language area. So number 3.
What does food,
Yes.
or types of food, got to do with aging, health?
Right.
Especially when you look at the diet in the US and then in Nigeria. My doctor told me once, I told her I was traveling to Nigeria, that you shouldn't bother about weight issues. He said, yeah, I know. When you get to Nigeria, you will lose weight because of the food. So I was very confident about it. I'm not sure if I've ever been to Nigeria. So.
But see, the point is that out of my lecture today, the diet, and we started late. The simple thing is plant-based diet. When you go to eat, look for things that are plant-like. Try and spend more time taking vegetables and fruits. And also, if you're taking fruits, what are the best fruits to take? Take fruits of many colors. Look at colors in fruits. Banana is yellow or green. Look for a red fruit like an apple. Look for black berries. Look for blue. So you're trying to take different types of fruits by color. It's called the rainbow choice, you know. And then we don't eat fruits as a matter of course. We eat fruits like snacks among black people. Ideally, every lunch should be with fruit. But many of us, we see orange, they give me orange. We don't take fruit like every lunch or every dinner. I must take an orange. I must take lemon. No, we don't do that. So we should do plant-based diet. How do you do plant-based diet? Cut down on animal protein, like cow meat. The best meat is the white meat of chicken. Then you can go down to turkey before animal meat, before cow meat. Chicken is safer than turkey. Turkey is safer than animal meat. Animal meat is safer than eating what's that thing they eat again?
Hot dog.
No, not hot dog. They used to cook a lot of times.
Bom.
Oh, no, hot dog. It's more of an Igbo soup. It's imported from Norway. What's that? Stockfish.
Yes.
Stockfish have nothing.
Yes.
It's zero, zero flavor. People will sit down there and say this is what I like this. So I have to change all this stuff. Then you do a balanced food plate. Can they balance the plates there? Everybody, carry on. If you look at plates, most plates have, is that a plate? Okay,
No, I think I have.
Get us one. So it's to eat, if you want to take pound of jam, if you want to buy a pound of jam, but take the size of your fist. Huh? That's too much. Look at your fist now. Is you, that's
Too small.
huh? Don't do that kind. You put that your wife, bring your money back.
This side has super size of
Of what?
fufu.
Okay, but if you do your fist like this, is you are training yourself. It doesn't mean that this is the best size. Start by aiming for this size of carbohydrate or swallow. You know? Start by aiming. Then, if you want to serve your meals, you look at the plate. Most plates start with something in the center here. That's the size of your pounded yam. So the pounded yam should take an area in the center here. The soup will not be here. But we put our pounded yam in all of this place. And put soup in it. I get in where 2 or 3 are gathered in. So that is it. Now food is not supposed to reach all these places. They are handles. This inner green here is where your food. But we keep our food in this inner green here and allow the mountain of Zerubbabel to be up like this here. This mountain I call a place here Zerubbabel. Not by might or by power. I think you have made the mountain like this, but this is how it should be. Your food should not go beyond that. But we like mountainous diet. The mountain like that. But really it's also poverty. It's poverty.
But metabolism plays a big role here. I know people who eat mountains of fufu and they are so skinny.
Yes.
And those of us that eat very little,
But this
we
one
put on they eat, we put on the weight.
See, at the end of the day, like I told you at the end of this, that all the children we ate from our source, and they affect us. Is that also? When you are growing older, after the age of 30, apart from your hearing diminishing at 35, at 35, you will hear the words cue behind your ear. They don't enter as fast as that. Children hear very well. People tell your child to say what's happening. Even in the elders are talking good. They are hearing everything louder than you can hear. Why? Their ears hear better than yours. With the same thing too with singing. If the power fails, the child is afraid and cries. Not because I'm missing, but it's the sudden change in life and happiness makes you afraid of something. But take note. When you say Junior, why are you standing? You are looking for Junior. But Junior comes to you first. Eh? You say, Daddy, I'm here, Daddy, I'm here. Say, where are you? Where are you? But the one that cannot see. Junior can see. In like manner, after 35, the enzymes in your stomach are older and less. So the capacity to digest food drops. That's why older people must swallow before 7. Or you not sleep well at night. There shall be a civil war. And there was war in heaven. Talking about the stomach. You know, you're blah, 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 blah. At times you wake up in the night almost belching and why did you go and take that food at 7? So when the sun comes down, take less swallow. And take swallow, take it at 2 o'clock. And do a lot of it because the food will not digest like before. You know? So that's how it goes. So the last question, second to the last. No, you know.
Yeah, so I think I was going to say, make 2 comments before my question. So the first one you've already talked about is when you talked about pregnancy in men being like they're having big tummies. The secret to that, whether for men or women, which I'm working on mine, except for this conference, my birthday, so I'm cheating. My birthday week, so I'm cheating. Is eating early, like you just said. Even if you sleep late, what I do to help me, I just chew gum if I'm hungry until I go to bed and just drink when I go to bed. But for men especially, I know as men of God, a lot of them have big tummies to them. You're like, wow, are they drinking or whatever? It's because they might fast all day, and at night they want to eat, they now eat late and go to sleep. So everything is just stored in there, and that's why these men of God grow tummies. God will help us. You all go see Elder Dr. Festus for his secrets. So,
What about Richard, Pastor Richard?
I've always known him like that.
It's always,
So Richard is one of those that their metabolism is very high. I finish, but I still look the same. Yeah, so like what you said is true, but it's not just because of that. The simple truth also is that our enzymes are not working hard. So this food takes a long time to digest. We should just remember that if you want to take swallow, take it before 4 o'clock.
Any food, actually.
Eh?
Any food, not only
Yes,
swallow.
take it when I start with, no, when we say food in Nigeria, it's swallow. I work with TV people, I speak some TV, and we ask them, have you been eating? They say, I've not eaten for 4 days. I write there, low appetite. I start, later I say, this is, I'm not eating poundage. Yeah, that's what I'm telling you. I took curry, I took beans, but I didn't take poundage. So I'm giving everybody anorexia, lack of appetite. When I submit it, I say, no, I'm not eating this week. I'll just write low appetite. When I find out that I've not eaten means I've not swallowed food. Food that you chew is not food, according to them. So it's good to eat. I mentioned swallow now because in African context, it's swallow that is lunch. All this rice, they're not food, they are snacks.
What about eggs? There are supplements that eggs
Yes.
can use to expedite the digestion.
Well, it says so probiotics and everything. But why don't you start with normal things and tell yourself, I want to eat, I want to stop this habit of eating late. Anybody that eats at midnight is killing himself. At midnight, you settle with egusi and panagia and say, that's where that's how God made me. I get me. That's not how God made me. You will just be passing out gas through the night. Your wife wants to change bedroom. You just say, this can't go any out except by prayer and fasting. So I agree with you. Yes, we should. And we should cut down our meals to, if possible, I eat once a day. I take only dinner at 5. In the morning, I take cornflakes or cocoa oats. In the afternoon, I take fruits. Then
And it's not once a day, if you eat 3 times.
no, what I'm saying, yeah, I cook out, give your husband cook out for lunch, whether you don't leave the house. And say, this is food. Say, cook out is the food. The biscuit there has some protein. Protein is in groundnut. You say, you are going back to Nigeria. So, food, when we say food, take it in once a day. Between the hours of 4 and 5 p.m. And after taking that food, you see, with this again, are you getting me? You know it's punishment now. You know? But most men of God too don't really eat so much because they fast a lot. So
It's late.
they eat later. Are you married to one?
Yes.
This one I know everything. Okay, they eat late. The way you are saying is as if you have seen it before. Yeah, but you can change that yourself. You are the general manager of the house. Make sure that dinner comes at 4. Many of them come to the house late. Yeah, they come back from work late.
It's not back from work.
Yes,
4 or 5.
Yes, not back from work.
Oh,
Then
you know
tell
that.
you tell him to take his food to work. You prepare his lunch and take it to him at work. And encourage him to start eating at work. When you come back home, you can take moi moi or something light and eat. But we have to insist because if a man dies in Africa, my wife kill him. If a woman dies, then you waiting. If you say a man has died, the wife has come again, women. If a woman dies, you know where she goes. So you have to take care of your husband because if anything happens to him, you are the first suspect. In the Nigerian military. So we need to arrange.
He kills himself.
I don't want to make her kill herself. You just go for one another, kill myself, and the woman. You know, that's even the most superior principality. They will send you to kill yourself. Like those pigs that Jesus said, the pigs ran away. So that's why he killed himself. How will he die? I won't touch him. Die like that. When one or 2 months. So I will have to organize the meals in the house. Come up with a meal timetable and try and keep to it. If it comes late, you know it is food after 7 p.m. If you are coming late, you either take it to the workplace or you are going to take nice cocoa, milk, Bonvita, with some digestive biscuits.
Don't work in America.
So people
I'm
will
gonna
take
do that.
food, their husband's food from one state to the other state during lunch, and then dinner, you go again to that state.
Okay,
You
yeah,
are
okay.
working in New Jersey, you live in New York,
Yes.
and your wife will prepare the food and travel to New Jersey to give you your meal.
That's why I said go work in
The
America.
man will get the buffet. When the wife doesn't serve dry food, go to buffet before you come to the house.
No, I don't know about that point. But the thing is, some men will just insist and go get the food themselves. If the wife says, no, you're not eating anymore, time has gone, they can go get the food themselves. So we don't have power over that one. So the next question is,
So
I know
I've been
that,
certain that this one is saying, there are some things that may be difficult, but we start from the known to the unknown. We start from the practical to difficult. Are you getting me? By just saying now, like every house you have what is called a constitution. Like in this house, you finish eating, you wash your plate. Alright? In this house, when we want to eat, we take our dinner at 5. If that doesn't come, we keep it for him. But if daddy sees that the pounded jam is small, daddy may have to eat outside before coming. That's what we're looking at now. But daddy should know that you are trying to preserve his life. So you can see his children to third generations. So we have to plan things and we make him to understand this message of today. You understand it? So you sit down and say which is most appropriate. That's how you start. We cannot do laissez-faire. Whatever I want to do the way I like. I want to do it the way I like. I want to do it the way I like. Is this how to do it the way I like? That make monkey to go to market. Monkey go market. More than I want the monkey go market. You know, unless if I make monkey go market, you don't come back. Who knows why monkey didn't come back? No, it's not true story. You know why? Monkey go market, didn't come back. Monkey not fine. One day, person will come market to look for monkey to buy. That's why monkey they go market, they come back. One day they go market, you know, come back. Why? Person when they look for monkey, will come there that day and say, I want to buy this monkey. Nobody buy him before. They chop it like chap, come and buy monkey. Who buys monkey? Very rare. You don't let them. One person will come to market one day. The sole purpose is to buy that monkey. You go market, you know. So that's the last one.
no, it's not the last one. So the second comment is, I know they were talking about food surrounding women's hormone, and that's why they might not be responsive and all of that. Now it came
I
as
said that's really reason.
okay.
I said that those things contribute.
Okay.
Those things contribute. I don't want to be taken to the cross and be nailed on the cross. I said those things contribute. There are many other. I started by saying that sometimes they are very angry about certain things that have happened in the past. When my mother was in burial, she did come for my mother's burial. That was in 2009. Today you are not picking it up. You didn't come for my mother's burial. I think I've forgiven you. Where is that thing coming from now? It's coming from remembering old stuff. I don't like the way you were the one that told me you're going to marry me. When we were ready for marriage, you changed your mind. If it wasn't God, I'm not wondering why you changed your mind. All those things, they didn't come back. Oh, there was a girlfriend you had when we were in medical school. When you were in faculty of arts, you were talking about, hey, Lara, how is she today? When did you talk to Lara? Bring your phone, let us. Those things are olden days. You are resurrecting Lazarus from the dead. You know, olden days you are bringing them back again. So, but ask your question now.
Okay, I just wanted to say, like you just said, that that is not the only reason why sometimes women are repulsive or not responsive. I'm going to leave that alone so we can move forward. So my question is, what is the place of faith in all of this? Because people have concerns about, oh, I'm 35, I'm going to go freeze my eggs, and somebody's hearing them say that, and they're like, why is she going to freeze her eggs at 35? She doesn't have faith, even 40 or 45 or 50. And you say, I just want to freeze my eggs in case I get married late and I'm going to have a hard time having kids. And this believer is looking like, are you serious? Like, are you really a Christian? Don't worry about it, just stay. If you're 55 and you get married, you're going to still have a child or whatever. So what is the place of faith in all of this? Because some people don't believe in medicine. They don't believe in taking medication. And so there's a story, a woman of God, a pastor's wife actually, she was on the prayer line and that's where she collapsed and died. So she's been diagnosed with high blood pressure, but she never takes the medicine because, oh, I'm living by faith. So in all of these things you have said, beyond food and all of that, right? What is the place of faith? Because there are some things people will call you faithless just because you want to create a system that could maybe save your life or make you live longer. Beyond exercise and all of those things.
Yeah, thank you very much. But the point is that my father will always say, how do you come across this man? When you are getting married to somebody, you do not know what the person stood for. Those things about faith don't happen in the middle of marriage. Imagine you marry a deeper life person. You should know before that she will always cover her hair, she will use makeup. It's not after a while you say, I want you to start using makeup. When the girl was not even using makeup as a teenager. So if it comes to faith and healing, if you marry someone that doesn't take drugs, you want to have known in the place of courtship what your husband can do and what he cannot do. So when it comes to somebody saying that I want to preserve my egg, that will not be in this generation of our children. In fact, my son met a young, but nice girl. Don't even, he always asks me that, why does she want us to go and preserve our eggs? I said, I'm not yet married. He said, in case you get married later in life. I said, but have you married her? He said, no. Okay, what is the problem? He said she wants to preserve their eggs. I said, not before you marry. These are things you can decide on after you're married. You know, so there are people like that. In fact, my other son met a girl who was to marry, and the girl said she doesn't want to have children. Doesn't want to have children. That she will have children by surrogate mothers, but that her body will not go through the strain of either CS or labor. Your children will not tell you this, but this is what girls are now saying.
That's
It's true. So they will go out of their way and get their eggs and get your eggs and get somebody else as volunteer surrogate, and person will deliver for you because she wants to PhD before she's 30. Right? She wants to be up and about. She wants to maintain a figure like Naomi Campbell, like all these girls. You know, they want to look. If you look at most singers today, they don't age. They are on all kinds of skin treatment and everything. They don't age. So you're going to find out that our children look at this as people they want to follow. You know, in the age of Instagram and everything, they want to be like that even at 50. And so you find that's the thing. So I want to agree with you that that is a personal decision, whether you want to save your egg or not. After all, Jesus was born by a surrogate mother. Was Mary not a surrogate mother? Mary was a surrogate mother. So if Mary could have Jesus without sleeping with a man, the Holy Ghost came and she got pregnant, there's nothing wrong in that. There's nothing wrong in that. But it's a personal thing in doctrine, it's a personal thing. That's why I don't marry a man that after you've gotten married, he starts bringing up very spurious doctrines. You know, like Jesus is not the Son of God. All those things are not things that should be resolved after marriage. There are things that should be resolved before marriage. Then, talking about the fact that, all right, yes.
No, because I understand what you're saying, but some things come up. I know a couple that my mom had to intervene, and actually, rest my mom's soul, she's died 7 years today. But, you know, some things happen like that. This man of God became a bishop, and I don't know, maybe a secretary or somebody was trying to entice him, and so he married the wife, no earrings, no hair making, no like salon work or anything on her hair. All of a sudden he wakes up and he wants the wife to put on makeup, wants the wife to wear earrings, wants the wife to do all of these things that he was okay with before, and now he's no longer okay with it. And so it was causing confusion in her house. So she actually ran to my mom, because my mom in scriptural union led the man to Christ. So that's like her son. Like, this is what's going on. I don't know what's wrong with my husband. So my mom just prayed with her and counseled them and told her for that season, it's not a sin. If it's a sin, then that's fine. My mom doesn't wear earring or do any of those things too, right? But if it's a sin, I will say stand your ground.
People like that, mothers don't wear earrings. This is the whole way. Because in most cases, they don't even have.
Right.
Yes. What they call a piercing. They grew up without being here. I've seen many children like that. No person, the mother said you not to.
So that's a different story because my mom didn't want to pierce our ears. She has 3 daughters. But my mother's mother told her, the vision you got was for you, not for your children. So when they grow up, let them make that decision. So our ears were
Okay,
pierced.
so let us take
Yes.
that. So that kind of thing is a very special case. The point is that nobody should, there's difference between sacrifice, servant, and servitude. In servitude, you make a woman a slave. In sacrifice, somebody makes a voluntary decision to do some things. So servitude is not called up by God. God did not call us to be slaves to one another. He called us to become husband and wife, co-heirs in the kingdom of God. So if you want to get a woman to change those things, you have to sit down with her and explain your new revelation, and then give her time, and also be ready to pay for the money for those things are not cheap. You want to buy some hairs in Nigeria like 250,000 naira. And it's yes.
More.
And it's
More.
It's the small girls that wear those ones. 250,000 naira. They wear 2 million, 2.5 million hair, you know, and they're earning 200,000 a month. 100,000. How they do it, it is gone. If you tell them how did you say,
Sorry, just one more thing,
yeah,
sir.
okay, say it.
One more thing added to that. One of the new revelation is the issue of vaccine. For those who are
Given revelations in church.
for those who are coming up, especially if they haven't gotten the balance yet, vaccine. Now, some men are coming up with the issue, having problems with children taking vaccines because, they've gotten a new revelation that people are using vaccines to give other children autism and make things happen to these kids. So, just throw some light on that.
Yes, that's what is being taught by the alt-right. You know, when we don't have what to teach again, we begin to teach esoteric things. They have finished the Bible, so they have to put other passages after Revelation. You know, they are just out of the blues. I know of pastors that teach these things, you know, but the truth of the matter is that these pastors come to the clinic. You know, they come to the clinic and they listen very well. They take a hepatitis vaccine. They do all kinds of things. But they talk in church. I know a pastor who is on dialysis, and he tells people, just trust God. Just trust God. If you stand on the word, which is true, but you're on dialysis machine. You do dialysis in a week. You're on television everywhere. You know, and yet they're telling people, the same thing to a marriage. Oh, you cannot divorce. Oh, God hates divorce. It's true, God hates divorce. Why don't you tell people God hates lying spirit and God hates anger, God hates suicide, God hates murder. If you want to teach God hates divorce from somebody who is living in the house and the husband has threatened to kill the woman, has used pressing iron on her back and she treated her back with pressing iron mark, I won't allow my daughter to stay with someone who carries pressing iron at night, put it until you're very hot and press her back. And then you say God hates divorce. That's not divorce again. That is, there was never a marriage. If the unbelieving depart, let him depart. Sorry, when I had to move a woman out of her husband's house, they called me at 11 p.m. in the night, and she had used kitchen knife to cut her husband from here.
Oh, Jesus.
And the other was bleeding, and I said, wow, she was angry. And so she cut here, there's something. Another one used the pistol of a mortar to hit the husband at night on the head, you know, and the man was brought dead.
Jesus.
You know? And this one was, look at what he did to your husband. He said, he deserves it. He deserves it. While she was doing that, I said, thank you, Lord, you can't stay in this house this night. You go and stay with one of the widows in the church until you are ready to be married. I can't leave you there. I didn't divorce her, but I can't allow her to stay there in the night, that night. After using the knife, I don't know what the man will do next. I had to move her somewhere else. After 2 weeks, she told me she has changed. She'll never do it again. And the man took him begging, I want my wife back.
Hey?
That same house in that chief.
Yeah, she would have died. She would have died.
This practical family situations when there's disalignments.
was actually supposed to be 1 hour. The doctor,
No, it was 2 hours, I given 2 to 4. I was given 2 hours. By mistake, my brother invited me. The letter I got said 2 to 4.
And you now did 3 to 5, so it's in order.
Yeah.
It's an important subject.
very, very important.
You did a good
That's what I'm
job.
saying. But we are not done yet.
That was a big thing. It's not, I want to say something about this autism. I don't know what is going on, but something is going on. Most of us who have autistic children come up after the three vaccines. My daughter was not born that way. She was a very, very smart girl. The doctor always said that I think it's good to have a baby when you are old. I was getting to 50 when I had her. And when she had that 3
Sorry to interrupt you. Children born after a woman is 40. After a woman is 40 years old. After, if you have all your children before 40, after 40, you are prone to having cerebral palsy, Down syndrome, and autism. So, children like our daughters should not marry.
If they find husband.
If they find husband. But I'm saying that some things that have to do with age, they are difficult to, even this thing that I said, vaccinations cause it. The point is that Dr. Robert Kennedy is pushing that doctrine.
Yeah.
But it can be proven that that is exactly that. It is from inference. I don't like what she's saying now. After the third vaccine, she changed. It happens. So I want to assure you that people that had this third vaccine after their child and their last child was 30, when you were 30 years old, don't complain about that. So there are so many factors to look at, DNA and all that thing. So I agree with you. It's possible environment.
So what I'm saying, I have compound evidence.
Yes.
My first daughter,
Yes.
who married at 27, had the same issue. She wasn't 40. She's not even yet 40. Okay. So her own, when the daughter was given the same, hives came on her. Instantly. Hives. And after that, the daughter dropped back. She dropped.
Academics and everything.
No, everything she dropped. She dropped up till now. You give her food, she says she's chewing. Even if she's drinking water, I say, I'm chewing. So make her call her, I'm chewing. She said, I'm chewing. Because the thing kind of after a while, it sees her eating her taste for food. Although she has come back, but the food thing is still there. So what I want to say, I've not done any research to see what I'm saying, but majority around me, friends and relations, seem to experience this in after 3 years. Okay. Then 2, I try to encourage people, when you go for vaccine, don't go for so many. I think because of insurance, they will give like 3, 4 at the same time. Spread it out. Because majority is on that vaccine that they experience this thing.
All right, we have a lot of people here that are experts in children with needs. But you see, the point is, autism itself is a spectrum. So the manifestation of autism is not specific in a way. There is only one way autism manifests. And autism is still a new disease. They're still studying it till tomorrow. You know, it was in the early 2000s that we started in the 1990s, started defining children with autism. Sometimes we used to think it was like cerebral palsy or things like that. It became very defined to become a spectrum. And the spectrum means there are so many ways they can manifest.
Yes.
So I would suggest that you're correct. People should be careful how they take the vaccines. But the vaccines alone,
It's not the cause.
so many children have managed dyslexia, so many things that at times they are in the genes of the father or the mother or the family. But I agree with you, we should be careful about these vaccines. Yes.
Because they are necessary.